a good-looking group.
Yeah, except one guy who is to the left of you. Otherwise he's sitting all right.
Yes, sir. Good morning, everyone. Good morning. Thank you all for joining us here at Bellevue Hospital today for a very important and exciting announcement. We're joined this morning by Dr. Ram Raju, President of New York City Health and Hospitals, Ken Rasky, President of the Greater New York Hospital Association, Pam Breyer, President and CEO of Maimonides Health Center, and Paige Bellenbaum, a Brooklyn civic leader, who is here to share with us her personal story. Also with us here today are Brooklyn Borough President Eric Adams, New York State Senator Liz Krueger, and Council Member Andrew Cohen. We're also joined today by New York City First Lady Chirlane McCray, whose honesty and openness about her family's struggle with mental illness has shined a bright light on the state of our city's mental health system and has inspired us all to come together to address mental illness as the public health crisis it is. As the First Lady has said, for far too long, we've had a tale of two health systems, one for physical health and one for mental health. That's why, under the First Lady's leadership, we have developed Thrive NYC, our roadmap to mental health. Our goal is to make seeking and receiving help for mental illness as straightforward and as uncontroversial as seeing the dentist or getting a flu shot. Just last week, we shared with you a white paper describing the size and scope of the mental health crisis in our city. 1 in 5 New York adults is likely to have a diagnosable mental illness in any given year. And each of those New Yorkers have friends, family, co-workers, and neighbors. Oh, it's so I can't compete with this. Oh my goodness. Even I keep looking over there. That means that mental health literally affects each and every one of us. Today, we're announcing a critical part of our roadmap to mental health, an important initiative that will support the mental health of a particularly vulnerable group of New Yorkers, new mothers and their children. About 12,000 women a year suffer from maternal depression. That's 10 to 20% of pregnant women and new mothers. And women with lower incomes are disproportionately affected. Our city can and will do more to help them. We talk all the time, we talk to new moms about how their babies are doing. We do that regularly. But now, we're going to talk to new moms about how they are doing as well. By making new mothers' well-being a part of their routine care and making sure that they have access to care and treatment when they need it, we not only improve mothers' health, but we support the healthy development of their babies as well. Here to announce our new initiative is the First Lady of New York City, Chirlane McCray.
Hello, everyone. What a wonderful day. We are so grateful to Bellevue and New York City Health and Hospitals for hosting us, as I cannot think of a better place to announce such our big and important news that we have today. Nearby in the hospital building is Bellevue's maternity ward. Right above us, little eyes are opening for the very first time and meeting the loving gaze of their mother. Just thinking about those first moments of mother-child connection makes me feel all warm and fuzzy. The birth of a new little person is one of the most profound and beautiful experiences that human beings can share. But as all of the moms in this room know, giving birth is also one of life's most challenging experiences. And I'm not just talking about labor. During pregnancy and childbirth, a woman's body undergoes a tremendous change. It can take months to regain equilibrium. And for many mothers, the transition is especially difficult. I am talking, of course, about postpartum depression. Studies suggest that at least 1 in every 10 pregnant women and new mothers suffer from it. Here in New York City, that means 12,000 to 15,000 cases every year. The actual number of cases maybe even higher, because studies suggest that many women do not get treatment for maternal depression. And Black and Latina women have an even lower likelihood of starting and continuing treatment. Now that's the bad news. The good news is postpartum depression is treatable. When we treat it, we improve the lives of thousands of women each year, and we give their babies a healthier start. Despite the great benefit it provides, screening for postpartum depression has not been a part of a woman's routine care. That is why today, the City of New York is setting a big and ambitious objective. Today, we announce our goal to screen all pregnant women and new mothers for postpartum depression. And if they need help, we aim to connect all of them to ongoing care. This effort will begin with the New York City Health and Hospitals, Maimonides Medical Center, and the Greater New York Hospitals Association. I am so glad that all three are stepping up to this challenge. New York City Health and Hospitals and Maimonides together deliver approximately 1/4 of all births in New York City. So they are exactly the right systems to lead this issue. Both New York City Health and Hospitals and Maimonides have committed to universal screening and appropriate connection to care within 2 years. Universal, 2 years. I think that deserves a round of applause, don't you? And the Greater New York Hospital Association is working to bring other hospital systems on board. I think that deserves another round of applause, too. You know, asking for help during what is considered to be one of the most joyous periods in a parent's life can be really difficult. It can be daunting. No woman wants to be a bad mother. But depression, coupled with the stigma and fear of being labeled a bad mom, can keep women from reaching out for the help they need. That is why universal screening is so important. It's essential. Now, so many people helped us get to this moment today. I want to thank them. I want to give a special shout out to State Senator Liz Krueger and Assemblymember Richard Gottfried. And I'm thanking them for helping to pave the way with legislation that provides screening guidelines to health providers, educational materials for maternity education programs, and removes barriers to care for our mothers. I'm also excited to work with Assembly members Latoya Joyner and Victor Pichardo, who are both strong advocates of universal screenings and working to secure new resources for our mothers. When it comes to changing the culture around maternal depression and mental health in general, we need everyone to do their part. Our work begins with the postpartum screenings we are announcing today. This is the first new initiative of Thrive NYC, our roadmap for promoting mental health, which we will release over the next few weeks. The roadmap is for all New Yorkers because all of us are touched by mental illness. Every neighborhood, every community, every borough, all of us benefit when we promote wellness. Thank you.
Thank you so much, First Lady. Now we'll hear from Paige Bellenbaum, who will tell us about her experiences as a new mother.
I just want to start by giving a special thanks to First Lady Chirlane McCray, who has focused her efforts on creating a much-needed mental health roadmap for our city, including screening for postpartum depression as a routine part of care during and after pregnancy. Thank you for recognizing this critical issue. I've been asked to share with you today my own personal struggle with postpartum depression. It's a story I've told on the Today Show, to the Wall Street Journal, and recently NPR, and just about anyone that I can find who wants to listen to me because I use my story as a tool for change. Through my entire first pregnancy with my son Max, I couldn't wait for him to come out. That big day came in the middle of the night on June 16th, 2006, and we were off to the hospital to finally meet our son. After 18 hours of a physically, emotional, and grueling and traumatic natural delivery, I was so exhausted when they put Max on my chest for the first time, all I could think about was sleeping. That magical moment you think is going to happen when you feel a burst of unconditional love for your new child, when you see him for the first time, couldn't have been further from how I felt. The next morning, we were discharged from the hospital. I was scared out of my mind, sore and stunned, and we were told we could leave because we were fine. Nobody at the hospital told me about the baby blues, let alone postpartum depression. Instead, I was given a bag filled with Similac samples and was sent on my way. The first weeks we were home together as a family were a blur. I had complications nursing, Max was born jaundice, and he had this severe case of baby acne, which made it hard for me to look at him. I felt flickers of elation and stretches of emptiness. I figured this was normal considering what my body had just been through. At some point in the beginning, things took a bad turn. I became extremely anxious about everything that had to do with Max. I was obsessed with whether or not he was eating enough, sleeping enough. I called the pediatrician daily, convinced that something was totally wrong with him. On top of the mounting paranoia, I felt totally trapped. Max refused to take a bottle, and he would only sleep when he was on me, so we were constantly physically joined. But I didn't feel emotionally connected to him at all. Instead, I resented him for making me have this new life that was unrecognizable. I sunk deeper into a dark sea, just wishing that someone would throw me a life preserver. I watched other new moms bonding with their infants, saying it was the best thing that ever happened to them, and to me, it felt like the worst. At some point, I stopped sleeping altogether. I was so filled with anxiety at night, I lay in the bed just waiting for Max to wake up and cry. I lost my appetite. I wouldn't leave the house or talk to any friends. I would sit on the sofa sobbing and begging my husband every morning not to leave me alone with this unpredictable thing that I couldn't control. I felt lonely and empty and scared and angry and so very hopeless. At night, I would sit curled on the bathroom floor while my husband and son slept, staring at the medicine cabinet, thinking about the pills behind the door that I could take to make all the horrible feelings stop. Certainly the two of them would be better off without me. I wish I'd never had Max. I hated myself for feeling that way and for being such a failure and a terrible mother. And I couldn't tell anyone because I was so ashamed and disgusted with this pathetic shell of a self that I had become. I want to stop here for a second and tell you that I'm a social worker. I was trained to recognize and identify mental illness, but yet I was totally unable to diagnose myself. I was lucky to get dressed in the morning. One day, after weeks of not leaving the house, we went for a walk. I was pushing Max in the stroller in a daze, and the light turned red at the corner as we reached it. I looked to the side of the street, and I saw a bus coming. I watched the front of the bus getting closer and closer, almost in slow motion. And in that second, it was right there, and I felt this overwhelming urge to throw Max and I right in front of the bus and just end it all, and make it stop. And as the bus passed by in front of us, I watched myself in the reflection of the window, and I saw this woman that I didn't know, but I knew she needed help. I hailed a cab, and I told the driver to take me to the nearest hospital. I was seen by a psychiatrist, and within 5 minutes, I was diagnosed with severe postpartum depression. I went on medication, started therapy, and slowly I began to heal. 9 months after Max was born, I went back to work and put the pieces of my life back together. And most importantly, I began to finally love my son more than anything else in the world, like I was supposed to. As time went on, I heard more stories like my own. I became angry that in this great state, nothing was being done to educate, screen, or treat women with this common condition. I told my story to my dear friend, State Senator Liz Krueger, and for 4 years we fought tirelessly to pass a bill that would encourage education, screening, and treatment for maternal mental illness. That bill was signed into the law in the summer of 2014. The First Lady's announcement today provides an additional layer to that legislation. Thank you, Chirlane McCray, for recognizing the prevalence of postpartum depression and for providing assistance to the thousands of women who suffer silently in this city every day.
Thank you. Thank you so much, Paige, for sharing that story with us, and for being so incredibly brave. You through your leadership, we're gonna help so many mothers, and I'm so glad to be able to follow you down this path to be a part of it. Thank you. It's a good example of how we need to move out of the shadows. We need to talk about these issues more. Until it becomes normal and commonplace to identify these challenges, to talk about them, we're going to keep experiencing these challenges. So thank you so much. It is now my pleasure to introduce the leader of this institution, Dr. Ram Raju, president of the newly renamed New York City Health and Hospitals.
Thank you, Deputy Mayor, and good morning, everyone. Welcome to New York City Health and Hospitals, Bellevue. It is so wonderful that the public hospital system and your public hospital system is partnering with other not-for-profit healthcare delivery system in New York City to promote screening for maternal and postpartum depression. The maternal depression, despite how common it is, affecting over 10% of the pregnant women or new mothers, still has an unjustified social stigma attached to it. Women are still uncomfortable discussing it with other women, and some physicians are uncomfortable discussing that with their patients. We must put an end to it, and we can put an end to it. Maternal and postpartum depression often go undiagnosed, but to treat a patient holistically, you must be attentive to both physical and mental needs of the patient. The screening of the maternal depression is not difficult. There's no real blood test or lab test. You don't need any fancy or expensive imaging involvement. It is basically asking the patients and connecting them and making sure that they are treated. It is so simple that must take part of the routine care. It should become the part of routine care of providing to all pregnant and new mothers. Through public education and through positive action by caregivers, we can overcome the stigma and help more patients open up and get care they desperately need. Also, there are a lot of precedents in public health for ridding the society of the unnecessary and undeserving and unjustified stigmas in the disease. Is it from the days of Ebola, or from the HIV, or from the other illnesses we have taken care of over a period of time, like substance abuse problems, right? As we look into that, we have underwent so many of the stigma and destigmatized it, and nothing is more obvious and present than what we have done when we treated with the HIV patients. The earlier phases of HIV epidemic in this country, people don't want to talk about it. Even mentioning HIV is a taboo between the doctors and the patients. A patient could become offended when you ask about the risk factors for HIV. But now we live in a totally different world. We routinize the test of HIV testing, and that became a common practice of screening for them. We overcome that by education. We overcome that through public awareness and making the HIV questioning and HIV testing a routine part of care in our system. It is for all patients in all settings. We can do the same. We can do the same for maternal depression. New York City Health and Hospitals screens for maternal depression. It is my hope that in the next few years, the screening become just a part of the regular practice of medicine in this great city of New York. It also should become part of standard medical training in our medical schools. It is just not for doctors. It is also for nurses, for physician assistants, and everyone who's involved in the care of the patient. Because while we make a regular practice schedule, a well visit for the children, why would not do the same thing for the moms? Mothers need specialized care as well, but not just for themselves, and also assure that they're providing good care to their newborns. I am really pleased and honored to team up with the First Lady of New York City, with the de Blasio administration, and with other healthcare leaders who really have the public service runs in their veins and time again proven that they always come to do the right thing for the New Yorkers. I'm very happy to join all of them, but this is a common cause yet to be treated well, and we are very, very proud to be a partner of this. Thank you very much, Deputy Mayor.
Beautiful, beautiful. Thank you so much, Dr. Raju. Thank you very much. Now it is my honor to bring up from Maimonides Hospital, Pam Breyer. You want this?
Do I need that? Yes, I need that. Oh, how fancy you are here. Well, I am sure glad to be here at this wonderful hospital. Bellevue is the city's hospital, and it's a great place from which to have this press conference today. Maimonides probably does deliver more babies than any hospital in the state of New York. We have a profound respect for those moms and babies, but we haven't been doing enough for them, even though we would like to. Now, I do want to say to start on a personal note that at Maimonides, we are thrilled to have been asked by the First Lady and very grateful to her for asking us to participate in this project with HHC. I've actually known the First Lady, Chirlane McCray, for a long time, and I know she's had her eye on this particular issue in funny ways for a very long time. And you know, it's impressive. I've been in healthcare for 35 years in public service and worked for 5 mayors, and I have never encountered anyone but this administration taking on a problem that's so right in front of our eyes. And I must admit that I learned about really firsthand at Bellevue, where I couldn't figure out why the mind and the body treatment were not like integrated. And here we are, and it is a really great thing. Now, as you've heard today, next year, about 9,000 beautiful babies will be born at Maimonides, and many more, 100,000 probably, will be born around the city of New York. And unfortunately, the joy of about 1,000 of those mothers at Bellevue will be muted by postpartum depression, and which, if not adequately treated, and I really want to stress this, not only can cause long-term harm to the mom, but to the child as well, and it really breaks your heart to think about it, ripping the fabric of the family. And the only way to break that cycle is to identify these women and provide treatment. In helping mothers and mothers-to-be, we can also intervene to help their babies grow up. And these babies, we know from sad experience and only too much data, the babies of moms with postpartum depression are themselves at terrible risks for, as they grow up, for bad things happening and a lot more undiagnosed depression and mental illnesses that only gets kids into trouble. And so here we are, and what better place to start this roadmap to mental health but at birth? I mean, it makes perfect sense, doesn't it? So what we need is a commitment, which we appear to have, and a really organized and all-out effort, and a pretty straightforward way of assessing this. This is really not rocket science. And you know what else we need, which we know in Brooklyn, and Ram, Raju, and not to mention Eric and others, Ram and I know that, of course, it takes a village. And so Maimonides and the HHC hospitals in Brooklyn, I mean, I hate to say this, Chirlane, but we've already started, doing this. I mean, I know this is a press conference announcing it, but we're in gear. And the staff who are doing it are really, really excited. And I know someone, was it you, Ram, who promised to get this done in 2 years? I can't believe we won't beat that record. We are really blessed today to have the opportunity to take this on. And I want to, again, thank the city administration and this splendid woman standing at my right, and say thank you. Thank you for doing something about something that people have not really wanted to talk about. So thank you all so much.
thank you so much, Pam. I want to quickly introduce two of my other colleagues from the city's health department. Dr. George Askew, Deputy Commissioner for Children and tell me your title. Family and Child Health. At the Health Department, we have very ambitious titles. And especially Executive Deputy Commissioner Gary Belkin, Executive Deputy Commissioner for Mental Hygiene, who really is very much the architect of all the investments that we're making. So I want to acknowledge both of them and their leadership. Our next speaker is Ken Rasky from the Greater New York Hospital Association, a key partner in the Maternal Depression Initiative.
Well, thank you. Thank you. Good morning, ladies and gentlemen. It's a pleasure for me to be here with such a distinguished set of speakers. And Madam First Lady, let me begin by saying thank you so much for your leadership and your vision on starting this initiative. This is a big deal, ladies and gentlemen, a very big deal. God bless you. I want you to know that the Greater New York Hospital Association is totally committed to providing the resources which are necessary to do the screening and treatment that will need to be done in this initiative. We have already started a task force. It's meeting this week. It's going to have experts in OB. It's going to have experts in pediatrics. It's going to have experts in mental health, taking all that pool of talent and combining it and coming up with protocols and activities that can be shared with all of our institutions. So our commitment is heartfelt. We believe we can make a difference, and we will. Thank you again.
Thank you. All right, short and sweet. I love it. All right, thank you, Ken. Our next speaker is the president of the borough of Brooklyn. No disrespect to the others, but my borough, Eric Adams.
Thank you. Thank you, and I want to add my voice to really thanking the First Lady. This issue is just so important, and taking these issues that don't appeal to people, to take them out of the dark and bring them into the light. For far too long, we have treated the byproduct of postpartum as a criminal action. And some of the headlines that you read that are harmful to babies really takes place because we have ignored this. We're finally saying that instead of placing handcuffs on our parents, we're putting them in the right hands of our medical facility, and it's the right thing to do. This is not a woman's issue. This is a human issue, and we all will be impacted by that. The long dream of giving birth was replaced with the nightmare of postpartum. And finally, we're realizing that. And the reason it has taken so long to move bills through the Albany legislature is because too many people are making decisions that never gave birth to a child. It is time for men to listen and stop getting in the way of this important legislation and move it forward. 2014. The governor signed the maternal depression screening bill. He signed it, but he didn't put any teeth behind it. It took the city of New York, the mayor of this city, and the First Lady to understand it can't be merely about signing a bill. It's about putting the finance behind the bill. Governor Cuomo put the money behind the bill so that we can have these screenings. That's a powerful story that we heard from the district leader. I think about when Jordan, my 19-year-old son, was born and what his mother went through in a depression, and I didn't understand it. The first sign that many men believe that are we dealing with an atmosphere where the mother is not a good mother. Not understanding, as the First Lady stated, your body goes through so many transformations and uncertainty after giving birth. And because we did not respect that, we have a tendency to believe that it's just that the child is not wanted. No mother wants to hurt her child. And we need to ensure that we give them the support, the assistance, and our intelligence to know that something is wrong. Let's give the help where it is needed. And the help should not come in the form of the NYPD. It should come in the form of our hospital and healthcare system. Thank you very much.
Thank you, Mr. Borough President, for your leadership and your testimony. Our next speaker is State Senator Liz Krueger. She has been, as you've heard, perhaps our most important partner in Albany, and the reason why we're able to be here today. I want to introduce Senator Krueger.
I so appreciate now having something to stand on. Thank you. I think that the First Lady might have something to do with it, because the rumors her husband doesn't need this kind of hide edition. I'm delighted to be here. I am so proud of our First Lady, our mayor, the city of New York, for taking this enormous step on behalf of maternal depression. I was educated about maternal depression through originally my friend Paige Bellenbaum, and then meeting so many other brave women and their families who had lived through an experience that they'd never imagined would so radically change their lives and the lives of their children. And as I met with professionals in the medical field, and I learned diagnosis is easy. Treatment for this type of mental health is disproportionately easy, and it works. And so the concept that it should take 4 years to get a piece of legislation through, and it's not as strong as we wanted, and there's more work can be done. But the fact that now we're in a situation where the city of New York is making a commitment to provide screening and treatment to every woman who gives birth in the city of New York is really just breathtaking when you take in what this will mean. And just in closing, because so many people have spoken, it is so important to understand the harm of stigma associated with mental illness and the importance of breaking past that. Because in fact, with maternal depression, what do we learn? What do we watch on TV and read in our magazines and see in our movies? Giving birth is the most glorious, wonderful moment in your life. You are supposed to be joyous and thrilled beyond comprehension. So for women who find themselves suffering from maternal depression, they suffer the stigma of thinking they must be the worst human being on earth, because this is supposed to be the most amazing moment. And as you've heard today, not always. So thank you also, First Lady, for continuing, I know every day, working to help destigmatize the issues of mental health and bring us to a point where in this city and ultimately in this country, getting treatment for mental illness will be no different than recognizing if you wake up that you have a medical crisis and you need to get surgery. You don't think of the stigma, you get yourself to an emergency room. When you are suffering from mental illness, you should also not be suffering from stigma, and you should be getting the health care you need as quickly as possible. So thank you very much.
Thank you, Senator. Our next speaker is the chair of the City Council's Health Committee, Councilman Andrew Cohen.
Thank you very much. I will just say, as the chair of the City Council's Mental Health Committee, I try to use that committee to shine a spotlight on mental health issues, to bring attention, to kind of move the discourse forward. And I will say it has been a very easy job these last 20 months because this administration in general and the First Lady in particular have exercised such leadership. I go to mental health facilities all over the city. Sometimes I go with the First Lady, but more often than not I hear, oh, the First Lady was just here last week. Really making the rounds, like this is not happening in some in a corner in City Hall, but really out in the field. The amount of work that has gone into getting us to this point is unprecedented. And I really just want to thank the First Lady for her leadership here and for being such a tremendous partner. Thank you very much.
Great. Now I'd like to open the floor to any questions about the initiative.
Thank you, Deputy Mayor. Just wondering, you said the goal for 2 years. Well, the initial goal is for these hospitals in 2 years to screen everyone. What's the goal to get citywide universal screening? And also, what are the costs for just these hospitals? And then if everyone gets involved, what would the cost be then, and where's the money coming from?
Great, thank you very much for the question. So, as you said, the goal initially is that New York City Health and Hospitals and Maimonides have both made the commitment within 2 years to be fully screening every new mom for maternal depression. That by itself would cover about 25% of new mothers. Simultaneously, the Greater New York Hospital Association is creating a learning community which will bring together Maimonides, New York City Health and Hospitals, and other hospital systems around the city. And our expectation is that we will have other hospital systems sign on very quickly and work together, learning from the experience of health and hospitals and Maimonides about how to bring this to a broader scale. The good news about this initiative, and so we think that by doing that work, we can cover the vast majority of new moms, and we can do that in relatively short order. The great news about this initiative is that this screening initiative is not primarily about new dollars. It's primarily about changing the practices and the workflows for OB-GYNs and pediatricians at hospital systems across the city to implement what is a very easy to administer, a very simple screening initiative. So this is an initiative that's not primarily about new dollars. It's primarily about new practice, and a new practice that will bring much needed resources and screening and ultimately treatment to mothers around the city who need it. Dr. Raju, Dr. Belkin, anything you want to add? No? No? Okay. Other questions? Grace?
A question for Dr. Raju. Since, as you said, the screening process is so simple, and people have been talking about postpartum for years, it's not a new phenomenon, so why hasn't it been a standard practice for doctors to ask their patients the screening questions to diagnose postpartum? Why hasn't this been done before? As it's not an issue of cost, we just learned, and you said yourself it's simple.
No, it's a good question. I think the question is, for the people who can't hear it, why is so simple, straightforward? Why every time we don't do it as a doctors? What need to be done? Yes, you are right. But what this program does is two things. One, it empowers the patients to think there is no stigma. If you have symptoms, bring it to the doctor so that they will be able to take care of it. That's one thing. The second thing is a lot of good practice is not consistently done all the time. So this will focus on the consistency of asking every patient, right, about the symptoms of depression and be able to connect them to care. So that's what this particular thing does.
Explain that right now are doctors not instructed to ask patients about symptoms of postpartum?
No, this is not being consistently done.
You know, can I chime in? You know, right. Thank you. Just to amplify what Dr. Raju said, I mean, because mental illness is a stigma, and because not just pregnant women, but certainly pregnant women go into the doctor's office, a lot of doctors really don't want to talk about it. They want to treat, look at the woman's physical well-being and go on to the next. And the sad fact, as the First Lady knows, is that, while this is a great place to start, it's not the only place where we find that we have to help doctors in hospitals and in private practices and community-based organizations to know how to ask the question and then get people into treatment. That's what this team sort of effort really is all about.
Thank you. I want to sort of quickly clarify a part of your question and then respond to this one quickly also, get the next question. The screening itself and the treatment that occurs, in many cases, insurance actually covers the treatment. The question is, do you have the practice? One of the new things that we now have in New York State is of October 1st, is that Medicaid will now also cover the screening and the treatment here in New York State, which is one of the sort of the inflection points that allows us to bring this kind of initiative to scale. And I also want to say, the question about why don't things happen consistently really gets to the question of the culture change that we as a city need to move forward among everyday New Yorkers, but also among medical professionals. Part of what we're trying to do is to take something which does happen, but institutionalize it to get to the place of the city where treating and talking about mental health and mental depression is as common as anything else. When I go to the doctor, they check my blood pressure. They check my weight, unfortunately. these are common. We expect these as part of our practice. What we're trying to do in some ways is to build this as part of our everyday practice as well.
As a perinatal psychiatrist, I'm thrilled. Thank you very, very much for doing this. My concern is that with screening, which is going to be amazing, what are we going to do with the patients, the abundance of patients that I think will come forward, that we'll find? What about treatment providers and facilities for these patients?
Let me start and then defer to Dr. Raju and any of our other colleagues that want to speak. First of all, part of the roadmap and part of the work that we're doing is really focused on expanding the capacity for treatment. So over the next few weeks, you'll hear more and more about investments that we'll make to close treatment gaps and to make sure that there's broader access to treatment and clinical support around the city. But I want to defer to Dr. Raju.
You know, that's a very good question in the sense that we are going to screening is easy, get done. When you find them, right, what are you going to do with them? The entire healthcare delivery system in New York State is going through a complete transformation. It's called DISRIP. One of the major goals of DISRIP is how do we integrate primary care and mental health together. So we are basically asking the primary care doctors to really do some of the mild to moderate mental illnesses over a part of the country. So there's a shift in the way we look at patients. We don't really say, if you have physical health, go here. If you got mental health, go there. That is a concept which is fastly fading away from the healthcare delivery industry. So by incorporating that, we'll be able to provide them care.
Thank
you. Can you just describe kind of what this screening is? I know you said it was very simple, but what exactly does it consist of? And also, I don't know if this is something that ever happens, but if for whatever reason a woman does not want to be screened, this is a voluntary thing. Does that ever come up?
Yeah. Dr. Belkin, you want to talk about the screening?
Yeah, hi, good morning, everyone. There are pretty widely accepted screening instruments out there. The one you might want to Google and look up is the PHQ-9, which is likely the one that these systems are going to be using. But they're really simple set of questions that basically go through the symptoms of depression. They have high reliability. They've been used very widely to scale in these sorts of efforts and are very familiar to these systems. And I want to echo what Dr. Raju was saying about, piggybacking on real momentum now and trying to integrate a lot more behavioral health care into primary care, including these kind of screening practices. So this is really a great tipping point opportunity to seize this kind of an agenda and feel confident that we could reach it.
Yeah, following up on the last couple of questions about making sure people get care, what happens if someone is found to have the symptoms of postpartum depression and they don't show up for follow-up care, or they're not, they don't really show any interest? What, if anything, are the hospitals or the health system going to do to ensure that they really do get the care they need?
Well, I'll defer to my colleagues again, but part of the protocols are not about only screening and connecting to care, but making sure that that's follow-up care. So part of the new systems and the new workflows that we're going to be creating, that the systems will be creating, is to make sure that moms actually get the care that they need, which in many cases may be talk therapy or counseling. In some cases, it might involve medication. And in most cases, it's an intervention that can happen over a few months, over 5 or 6 months, before most mothers are well again. I don't know if you have anything to add. Yeah, sure.
I'll just do this.
Sure?
Yeah. So what's going to happen in Brooklyn is what's already happening, and that is that Maimonides and HHC have already developed a web-based tracking system with people who are actually looking at tracking patients. And so if someone just drops, the idea is that no one drops out, that someone who's well-trained will notice that this mom has not come back and call her and see, not to force her into treatment, but the idea is to weave a system that connects the various providers, the psychiatrists, the primary care docs, the obstetricians, the social workers, all these people. And we've been working on this more broadly in Brooklyn. And so we feel like we're set up to really try to deal with exactly the question you asked. We're going to have to work out protocols and testing and all that stuff. That's what's going to take time. But I think in principle, you know, we're pretty much in agreement that we need to help patients make it easy for them to come back to treatment.
Can you talk a little bit about what you're doing at Bellevue?
Thanks, I might need this. Thanks. Hi, I'm Dr. Judy Green. I'm a reproductive psychiatrist here at Bellevue, and I've had the good fortune to have the support of both our psychiatry department and our OBGYN department, and we have co-located care here. We've had this for the last 5 years, where we're able to treat women during their prenatal care appointments and postpartum appointments when they present with mental health symptoms. So it's an example of integrating the care with our OB providers. We also integrate the care with our pediatric colleagues and our child and adolescent psychiatry colleagues. So this can be done. It's certainly not as simple as just screening and referring, but this wonderful initiative. Thank you so much, Chirlane McCray. This is amazing for our patients. I just want to give a shout out to the fact that a number of our Bellevue patients are here today to show their support for this initiative. Thank you both for coming with your children. I have to say, just as a last comment, it's like a dream for me to have this culmination of people I've known, both colleagues from all these different disciplines, patients that I've worked with over the years, trainees. We have a fellow here who's been doing this work on the front lines, and loved ones, of course, as well as the politicians who are bringing this to the forefront. So thank you all for helping the women and the families that ultimately benefit from this initiative.
Thank you, Dr. It's time for a couple more questions. There and back.
Just a quick terminology question. Is there any meaningful difference between maternal depression and postpartum depression?
Question?
Yeah, postpartum reflects the postpartum, the post-delivery period. And maternal depression tends to be a term to capture both during pregnancy and after delivery. And the more we learn about this, the more we're finding that depression is very common during pregnancy, and the postpartum period risk period can last up to a year after. So it's, we want to take this issue on in full, and so maternal depression captures that fullness.
This is probably off the side, but
can you speak up a little bit?
Yes, this is like for us at the Postpartum Resource Center, like a dream come true. But this is happening in New York City. In this era of scarce resources, where nobody wants to spend money on education and on health, what can we do as citizens to stimulate our state government to make sure that this doesn't just happen in New York, and that they don't wait to see what falls out before they get started?
Well, again, here in New York City, obviously what you're seeing here is a deep and strong commitment on the part of city government. Under the leadership of Mayor de Blasio and the First Lady Chirlane McCray, we are making deep investments in the system, and this is obviously a part of it. We're very glad to have partners like Senator Krueger in New York State, who are also leading the way in Albany in ways that make it possible for us to lead here in New York. Thank you. You here?
You said the goal is 100%. What percentage is occurring right now? Where are you toward that goal?
We don't have a real baseline yet. I mean, we know again that between these two large systems, if these systems achieve their goal, we'll reach 25%, and our goal is working through Greater New York hospitals to reach all mothers.
Nobody's tracking where you're at right now.
Forgive me, Mr. Deputy Mayor. Dan, on that question, one of the things that we will establish is a statistical baseline where we're at today. You heard from Pam; she said that she's jump-started it to some degree. I'm sure, Ram, you may have done that too, but I don't know where everybody else is. We will develop that baseline and then measure progress from that point forward within the timeframes that we're talking about. So that's going to be some data that we're going to be collecting, and you'll see it.
We have time for one more. There's somebody who hasn't asked yet.
Yeah, just one question for the task force that one of the gentlemen mentioned was going to be, I think, meeting later this week. is that task force going to include representatives for social support of moms who are going through postpartum depression or mood disorders?
Yeah, the steering group that we put together was put together by our staff, some of which are here today, and it's going to be a combination of representation of the various disciplines that get involved in this from our various institutions. We normally ask for volunteers because of the time commitment that goes with it, which is usually sizable, and a call of that variety has already gone out. Are you suggesting, sir, that you would like to volunteer?
I'm a volunteer with the Postpartum Resource Center in New York, but I was just...
Well, that's how we do it. And we let the institutional leadership in the various departments come up with individuals who they feel are skilled. And then when they go back to their respective institutions, obviously physicians are talking with their colleagues and they come up with different ideas and then bring that back. It's a fascinating and great learning process. And on that issue of going beyond New York City, our representation goes well beyond New York City too. So we will be spreading the word on that, Senator, as far up as we can possibly go. Thank you.
All right, we'll take one more question. We'll get back to you. All right.
Tell us a little bit about when the full roadmap will be released and how these portions that you're previewing will fit into it. Will there be a bigger expansion of this program in the roadmap?
The full, as the First Lady said, the full roadmap will be released in just the next couple of weeks.
Pieces fit into
And this will be a part. And this will be a part. It's absolutely be part of the roadmap.
Right, let me say. The roadmap will be released in just a few weeks. We wanted to launch with this initiative because one of the most important principles of the roadmap is act early. We know that if we act early, that we can prevent more serious mental illness from developing along the way, and we just thought it was very appropriate that we begin with the babies, and so we could show with the babies and the moms that we can really have a huge impact. We just see the signs and the symptoms, and we take action, and it is so easy. It's something that we already know how to do. We need to make sure that mental health is not sidelined and put away from physical health. So we look more to come, and you will definitely be made aware of when it's happening. Thank you.
All right, thank you all very much. Thank you.